Good afternoon, my name is Soto and I'm recording this video for my class, the surgical procedure class. As you can see, I have my table set up today for my video. I'm also having my gloves on because I think this is a more sterile procedure or more sterile setup. And so I have everything on, and I also have my OR boots on too. Okay. So I'm gonna tell you what I have in the table and hopefully find the use, know the use for it. Thank you. Okay, my first item that I have with me, it is the bassinet or the plastic bowl to put in the OB. They'll use it to put in the placenta in here, but it can have many use in the OR. Okay, number two, we have what is called the Mayo stand cover right here. Okay, and this one, it tells you the instructions on how to put your hands in there, your right and your left. And then with this, you open it up and then you cover the whole Mayo stand. It goes from here and then goes down. Okay, this is the sterile field where you're gonna put your instruments after. We also have here what is called the specimen's cup. I closed it, it came open. And the specimen's cup in here, okay? So what you do with this, you have it next to you, and then you put in your specimen in here if you're gonna send it out for a biopsy for testing, okay? And the needles, I also have two sides of different needles in here with me. Okay, this can be used to draw or to draw any either lidocaine or saline, and then just use it. Okay. We also have here the hospital disposable pitcher. If you can see, it has like a measurement numbers right in here, and they come in ounces and cc. Okay, up to 32 ounces or 1,000 cc. Okay, so this one, it can be used to measure like the output for the patient, either output on blood, fluid, or even urine, to see how much the patient has come out. Okay, we have also the sponges here, or also called Raytag. Okay, special ones. They come in sets of 8, and this is a counting item. So you will count this when you place them on the table, and also when after the surgery is done, you need to count how many of these are out. We don't want to leave any of this in the patient. Okay. So we have also this right here is another sponge, and this one we use it for any types of surgery procedures. Okay, this is used for like in the inside of the patient's body. It has a special little extra connection here that if this stays inside the patients when they finish the procedure or the surgery, this can be visible in an x-ray. Okay, and it's also the color blue that is easy to see and not to lose it in between once all of this is soaked in blood. Okay, I have here the suction. Okay, and the suction catheter is called it's also to prevent or to suction. Okay, this is the Yahooker tip. Okay, and I'm trying to see if this does it connect. I think this connects to this one here. Okay, right there, and then you put the rest on your, if I'm thinking right, into your pitcher to measure the output of either fluid or blood. Okay. Alrighty, and then we continue with the the tubing. This is the McKesson tubing. I'm sorry. So this is the McKesson tubing, okay, which we'll use to put inside to measure how much fluid, blood we're getting now. Okay. Okay. So we already talked about the lab sponges. Okay. So this keeps the surgical incision free of like body fluid, blood, and other liquids on this one, okay, which is very nice to use, okay, to control the bleeding. We have the disposable bag. This bag, it has like 2 little pieces of tape on the side that you can put on your table. You open it up, and then you can use it for all the disposable items and sutures, and they can go in there. So at the end of the procedure or the surgery, you count everything that needs to be disposed. You count them, and you keep it in here. Okay. We have the pen and the measurement, and also the labels. So the pen is very important to use it in the OR setting, because the surgeon needs to know exactly where he's gonna mark in order for him to do the incision. So very important. Why the measurement tape? The measurement tape, it tells the surgeon can measure from one area to the other area, and so he'll say, I'll do an incision here, and then about 27, we'll make another one right here, and then he'll mark it with the special skin marker tape that we have. This one is special because it don't say come off once you're working on the body. Okay, the label, we use it to mark any source of a specimen that we get or samples that we get out of the patient, and we put it in this specimen container, and then we label it. Always label. So it's always nice to know the size, just to prevent any wrong side, any wrong procedure, or the wrong surgery. So it's important to mark it down. Okay, this is a joint commission requirement in any OR. Plus, you are going to need this for writing down what the surgeon says. If he says, I took a 12 o'clock sample from the cervix, then you just mark it. Okay, 12 o'clock. Mark it with the marker. Okay, and that will be it. My items that I have. Hopefully I got all of them in. I feel like I did, and if I don't, I will ask. Thank you.